This episode is brought to you by Oats Overnight. Do you skip breakfast or find yourself always stuck in a drive-thru? Well, Oats Overnight is a high-protein, low-sugar, gluten-free, overnight oat shake you can take on the go. It's available at oats.com. That's spelled OATS.com. And if you go right now, you can save 10% with the code DARKO10. That's spelled DARKO10. Life is hard. Make breakfast easy.
Welcome to Docs Outside the Box podcast. This is your official show, looking inside the minds of cutting-edge and innovative doctors. Think you'll find these stories in any medical textbook? Sorry. You're getting real life insight from men and women pushing the envelope beyond medicine. Ordinary doctors doing extraordinary things. Let's start now with your host, Dr. Nee Darko.
What's good, everyone? This is Dr. Nee. Welcome to the next segment of Ask Dr. Nee. I got my special guest with me, my ace, Dr. Renee. What's up? What's good? How you doing?
Hey, what's up, Docs Outside the Box Nation?
Yeah, just like that. When I envisioned it being said, that's exactly how I wanted to say it.
I deliver.
Okay.
I'm OB, so I deliver.
All right. So we've been getting questions. People have been asking us some really good questions.
Yeah.
And we also have some comments from Speakpipe, which I've been telling people to go ahead and submit, their questions or their comments on Speakpipe. So remember, if you go to drneedarko.com, on the homepage, if you go to the right-hand side, you'll see a little blue, kind of out or insert or a tab that you can click and ask me any type of question and we will answer it. So we've gotten some comments. So I'm pretty excited about that. But before we get to that, I just wanted to kind of set some context and let people know
Set the scene.
Like, what are we doing right now? Like, we are sitting here. It's late at night. You got our second-born sleeping on you right now.
Mm-hmm.
Firstborn is upstairs, but we're sitting with a whole bunch of boxes around us, getting ready to do that move.
Yep.
You know what I'm saying?
Moving on now.
Yeah, we're moving on out. You know what I'm saying? We got pretty much less than a couple of days to go, and we're ready to kind of move on to the next stage in our life. How do you feel about that?
I'm super excited. We came to Pennsylvania. We did a lot. We experienced a lot. And now it's time to move. It's time to move closer to family.
Yeah.
I think I'm ready to do that.
Yeah, I agree. I think you said it best is, nothing lasts forever.
Right.
And it's time to turn the chapter. And, I think we got a fork in the road and it's we're time to make a decision and be like, okay, well, let's get a little bit closer to family. We got 2 kids now and let's do the thing that we've always wanted to do.
Yeah. All good things come to an end. And I think at some point we need to probably do an episode about that as well. But just to stay on topic, I think we came to Pennsylvania. We accomplished a lot of things. We were able to pay off our student loans. We had 2 kids, like you mentioned, and now we're taking the best parts of Pennsylvania with us, and that is our 2 boys. So, ready to go back home.
Well said. Well said. So, we got 2 questions. Well, one of them is from Facebook. One of them is from Instagram. I love the gram. And then we got 2 from Speakpipe. If you don't understand that, go ahead and look it up on Google.
I love the gram.
Hey, I'm addicted to it. I know I am. All right. So this first one is from Dr. Saba. And we got this from Instagram. And she says, "Hi, my name is Saba, and I am a vitreoretinal surgeon. I'm currently employed part-time, but I definitely way underpaid and don't see any growth in this practice. I have 2 kids under 2, so I want to be able to do locums locally or at areas with short flights. How do I go about approaching places? Thank you for your advice." So I think that's a really good question. Do you want to go first?
Oh, man. First of all, welcome to the life. Welcome to the life of young children. And, being a mom who wants to spend, obviously, a good amount of time with them. And so if I understand your question, or at least the reasoning behind your question, it is one, because you feel, that you're underappreciated and underpaid at work, but two, you recognize just kind of the value of being able to be with your children, on more days maybe than not. So I don't know, like approaching places for locums right off the bat can be an intimidating thing, I think, for someone who's never done it before. And that's not to say that it's not doable. It certainly is. And so what I would say is if you want to approach them as kind of just a private doc, I would look for practices in your area, especially the smaller practices that might have maybe one or two doctors, because those people are probably on call either 24/7 in some cases, if it's a solo doc, or they actually might use locums already and just maybe looking to introduce, one more person as a locums doc. The other thing you can do is actually you can just start with a locums company, a locums agency, and start there. As far as getting places that are local or having short flights, again, it's all about demand, in that area. So that's where it's going to be very specific to where you live.
I agree with everything that you said. And I think that we should give her props. Dr. Saba, we got to give you props, first of all, for recognizing that you're way underpaid. I think that's really important to understand that. And then to even, see the next couple of steps in front of you, too. And if you see that you're not going to grow the way that you want to grow in this practice, then I got to give you props for that. And I think it's really important for people to understand a couple of things. One, I think doctors really need to understand their value that they bring to the healthcare system, or just their value, at least what they bring to their specific practice, or if they're employed by a hospital, what they bring to that hospital. If you're going to go ahead and do locums, I have a couple of steps that I think you should follow. And this is for anybody who wants to do locums. Is I think the number one thing is recognize that just being a locums is not the end all be all, right? The answer to whatever your woes may be or whatever issues you may have may not just be solved by just being a locums, right? I think that if you scratch the surface and if you go a little bit deeper, it really does come down to mindset change. Okay. And what I mean by that is, and I think you know where I'm going with this is, you understand what value you bring to a hospital, but just recognize that life happens also, and that you have to be very flexible in how you work. So looking at it from a 30,000 foot view, I think the first thing is just recognizing that the old traditional way of you working may not work currently right now. So be open to just engaging in working in a different way. I don't know if working nights or, working just something very different than what you're used to may have to be that sweet spot for you. I don't know, but that's just something that you may have to consider. So I think that's the most important things to get that mindset change. I think number two, I would say, I always tell people this is if you're going to do locums or you're considering doing locums is during that time, or if you can, try to quickly save up 6 months of expenses. And the reason why I say that, it allows you to be really picky when looking at locums positions. If you don't really have much in savings, you're going to be tempted to take positions,
right?
Whatever positions are thrown your way, and you're going to be taking and making decisions really hastily and really not thinking them through because you really need to pay the bills. So I think that's one of the first things you really got to do is just make sure that you kind of shore up, your bank account and make sure that you have at least just 6 months of expenses. So that it allows you kind of sit back and kind of look at all the job offerings and then take the ones that you really think are attractive. If you're going to work with a locums company, I would just say, don't just work with a locums company, work with multiple companies, right? Work with multiple. Just because you work with one, they may have access to a bunch of different jobs, but they may not have access to all of the jobs.
Right.
So as a result, I think it's best and it's wise to contact not just one, but two, right. 3. I feel like I'm LeBron, not 1, not 2, not 3, not 4. from the Miami Heat days. But no, seriously, like you may have to get in contact.
You should.
You should be in contact with more than, I'd say, to locums companies.
Yeah. And people, to that point, people often, there are a lot of docs who will ask me about locums, and many of them will kind of feel guilty about looking to another locums company.
Yeah, let's talk about that, because we see that a lot.
Yeah, I see that a lot. And I always tell people, I'm like, do you know that the first person who introduced me to the idea of working with different locums companies was actually the locums consultant that I first worked with. He's the one that said to me, you should never work with just one company. Now, he's a rare bird in the locums world, because I don't know that any consultant would ever tell me that. But yeah, you don't have to be loyal to a locums company. So you should always work with multiple.
These docs ain't loyal. Oh, man. I'm just in a singing mood this episode.
Apparently. I got to catch up.
Oh, man. But I agree with you there. And I think it's also important to speak up for yourself also. And what I mean by that is when you start to walk up and talk to these companies, they're going to give you an initial offer more than likely, right? If you think you should be paid more than it, then ask for it. Okay. Yeah. You don't have to be pushy about it. You don't have to be rude about it, but literally just be assertive and just say, like, I'd like to get, $10 more per hour, or, $20 more per hour, or whatever.
You don't suggest that they be like me?
What do you mean?
So I had a locums company call me once, and it was for a job in New York, and it was very low, like very low. And I basically said to the consultant, you can't afford me. You don't.
Yeah, I don't know if that's really necessary to have that type of conversation. The mindset, though, we understand, right? Like, it wasn't worth it. The sentiment is, it's not worth it enough for me to work there. I don't think that's necessary an answer that we all need to give to them, but I get your point, and you guys get the point also. But basically, if you feel like you need to be paid more, then go ahead and ask for it. And the same thing goes, let's take a step back when Dr. Renee was talking about working with different companies, or if you work with one company and then you want to work with another company and then you feel guilty about working with multiple companies, like, just know that, people who work in different specialties, not in medical field, but in different, what's the word I want to use, in different careers,
industries, yeah,
they use multiple headhunters all the time, right? And it's expected from these companies that you're going to be working with another company. So you know how, like, when people have a financial advisor they're not happy with, they feel this guilt. I mean, it's the same thing when you're working with these locums companies, that they should expect you to want to negotiate a little bit more.
So, I mean, the one thing that you don't want to do is, one, put yourself in the same situation that you were in as a permanent physician, considering that that's the reason that you want to get out, right? So, for example, oftentimes we are so indoctrinated into the way that medicine works and the way that we work in medicine that we then recreate that same situation, but as a locums. Right. So, and it's very easy to do, because you certainly could get a locums position where, for example, if you were working in an office setting, now you get a locums position working in an office setting. And if the office setting is not something that you like, then that's probably not a locums position that you should take, right? So, you have to think about how it is that you want to work as a locums. If you're just going to do call, or if you're going to do hospitalist type of model. If you do like clinic and you only want to do clinic, you don't like to work in the hospital. Like, there are opportunities out there where you can pretty much tailor make what you like for locums, but you just have to be assertive. And like Dr. Nee said, if you have some months of expenses that are saved up, you won't feel so pressured to take whatever opportunity comes your way.
Yeah, the first offer, and I agree. That was a really good point that you mentioned. The other thing, too, I think that you should do when you are talking to these companies is just be honest about your schedule. With kids under 2, traveling like a normal locums that's going to be a little difficult. I mean, it's doable, but it's going to be a little difficult. So be very honest. And then remember, though, like you are in charge of your schedule. Like this is the opportunity for you to experiment. If you don't like one experience, it's not like you're being fired, right? You're just leaving and going to do something else. So you get the pick of the litter and being able to choose all the different types of practice experience that you want. If you want to work in a private practice or clinic type of experience, then you may get that option. I don't know if based off of your specialty, if vitreoretinal surgeons get to do like a hospital-based experience, but if you do, then, look at that also. So, and then last but not least, what I would do also is I would contact local practices. I know you mentioned in the beginning, Dr. Renee, I would contact local practices or hospitals and ask them if they need temporary coverage. If they have someone who's on vacation, give me a call, and usually what you should do is just say, look, like I'm cheaper than having someone employed, right? Because all you need to do is pay me an hourly rate. I take care of all the benefits by myself and that's it. So I would not hesitate to contact local practices around you or maybe even further away, particularly their large multi-specialty groups and see, and even the smaller ones, and just see, hey, look, if you have a partner who goes on vacation or goes on maternity leave, I can be the one who can provide that coverage for you guys. So
absolutely.
I think those 5 steps, including the steps that Dr. Renee said, I think those are the things to consider when starting to, approach places or even just get to the mindset of being a locums, with the biggest thing being, just try to kind of break free of the old traditional way of working and realize that, you may have to just look at more creative ways of
be
working.
Flexible.
So Dr. Saba, I hope this helps answer your question. And I just want to say thank you again for submitting your question. This was a really, really good question. I just really hope that it works out for you and your family.
Good luck to you.
So this next question is actually from a PA student, which I'm really excited about. Whenever I think it's time to do actually a new survey. What do you think? Because we need to know when we did the survey years ago or a couple of years ago, it was mainly, attendings, medical students, pre-meds. But the one thing that is really interesting is I want to know like how many students from not just medical school, but obviously we're getting students like from physician assistant school.
Practice or
absolutely.
I think we're calling them advanced practice.
Yes.
Right.
Yes.
Or advanced practitioners. Can't remember.
This was a great comment, question. But he reached out to me through Instagram, which is my favorite way to keep in contact with people. The gram. And he says, hello, Dr. Darko. Your work is inspiring. I am a first-year PA student interested in trauma surgery as a potential career outside of school. I know being a physician, you may not had much interaction with PAs, but was wondering if you can give an insight on how a PA might function within trauma surgery. Where are you currently practicing right now? So this is a great question, mainly because I have a pretty good experience with working with physician assistants, particularly in a suburban kind of rural type of experience at a level 2 trauma center. And I've done locums at various places and seen different experiences working with PA students. I would definitely say the best experience that I've had working with physician assistants is where the physician assistants basically are like the constant, and they are the ones who are making sure that, the patient interactions, things don't fall by the wayside, even though the trauma surgeon may change on a weekly basis or every 2-week type basis. And also I've seen physician assistants be allowed to place central lines, particularly in emergent settings. I've seen them, assist in the operating room, work in the ICU, literally working hand in hand with a trauma surgeon. And it's been a really great and rewarding experience that I think the PAs at this one place. I've seen other places where it may have been a little bit difficult, for the trauma surgeons to kind of start working with and allowing, independence with the physician assistants. But, I think for the most part, what I've seen, particularly at level 2 trauma centers or trauma centers, which are in rural and suburban areas, I feel like the PAs get a very rewarding experience where they're able to do a lot more than what they really expect. So I just think that if you can find a place similar, I wouldn't go to like a large urban trauma center if you're looking to work. But I think if you want the experience of seeing some trauma that you won't necessarily see, in suburban and rural areas, then go to, a big inner city type of area. But in terms of trying to work, I think you should try to look for, those suburb areas, those rural community-based type trauma programs where it's you and one trauma surgeon, maybe a couple of PAs and a trauma surgeon. And I think you'll find that you'll be able to do a lot more in that respect.
Yeah.
You've worked with PAs, right?
So no, I've actually never worked with PAs before. I've worked with residents. I've worked with obviously OB residents, but I've worked with family medicine residents, which is a little bit different for many OBs who are in either academic settings, whether it be, community-based or otherwise. But, oftentimes when you're in an academic setting as an OB, you're dealing with OB residents. And in my case, I was dealing with family medicine residents. And so it's a little bit different, right? Because obviously the education isn't necessarily the same, right? The amount of education that an OB resident has in OBGYN is going to be much more than the family medicine resident has in OBGYN, right? As a specific specialty. But, even in that setting, it was at least rewarding for me and definitely rewarding for the residents. So that's my experience, but I've never worked with PAs or NPs before.
Well, definitely a great question, definitely a perspective for the listeners who have not had an opportunity to take the perspective of a PA student or a PA. But this is something that I think is going to become more of an issue, and not in a bad way, but more of an issue that we all need to think about. So Excellent question. Thank you for shooting that in.
Yeah, thank you.
So before we get to our next question, we'd like to talk to you about Oats Overnight. They are sponsoring this episode, and we tried it.
Yep,
we tried it, and actually we continue to use it. And look, for me, I can't front. It's good. It's delicious. And with my schedule where, I'm traveling from one part of the country to another part of the country and also doing trauma surgery with these 7 a.m. to 7 p.m. type shifts, I'm up as early as 5:45, 7 a.m. Like, I don't have the time to make something really elaborate in the morning. I'm skipping breakfast a lot. I'm getting breakfast on the road. It's very convenient for me. So I'm really, really excited about this.
I really like it. I enjoy it. I mean, if you are busy, if you're the kind of person who is on the go or you have a busy morning, you have kids and things like that, it's really, really convenient. It literally takes about 30 seconds to make at night. You just put the ingredients in a cup, you shake it up, and then you put it in the refrigerator, and then that's it. It's done. You wake up in the morning, and all of a sudden your breakfast is just made. You literally shake it up again and then just drink it. And I got to tell you that two things. One, I'm not necessarily a person who loves oatmeal, but this is really good. I can't front. It is really good. And two, I'm breastfeeding, and, oatmeal is supposed to be known as a kind of milk booster. And so I can't say that this is scientific fact, but I can definitely say that since eating the oats overnight, I have noticed that I'm producing a little more milk, at least when I pump. So, yeah.
Well, for the nerds out there who want to know, this product is high in protein. It's low in sugar. It's gluten-free, right? For all those people worried about their stomach. It's really like a delicious overnight oat shake. That's the best way I can explain it. Okay.
And they have pumpkin spice.
Oh, yeah. They got pumpkin spice for all you fall heads out there.
I love pumpkin spice.
They also have vegan options also, including chai latte, right?
Oh, that one is good too.
Right?
Yeah.
So, the biggest thing for me, obviously, is the 0 morning prep, right? The thing is, like you said, 30 seconds of prep the night before. It's ready in the morning, and I'm taking it and I'm drinking it while I'm in the car, or literally drinking it as I'm walking into the hospital, or even getting sign out, know, so it's very, very convenient.
Yeah. And it really is filling too, because it's like a meal, like you're chewing. So, it's not like a regular shake where you just drink it down. You actually are chewing. So for me, I like it. It tastes really good. And the pumpkin spice is on point.
Yeah. So if we have a little thing going on for the listeners right now. If you're interested in this, I think this is a great opportunity. If you use the code DARKO10, that's DARKO10, right now you can get 10% on your first order with Oats Overnight, which is amazing. So, and you will get a starter pack, okay? The starter pack will come with the container, which makes it very easy, as well as whatever flavors you select, which I think the flavors are amazing.
Yeah, the flavors are really good. They have a large variety of flavors.
A large variety, so you don't get bored. And the cool thing is look, the starter pack comes with a full money back guarantee. So if you are not satisfied, you can try this risk-free.
Or if you're not satisfied, you can just send it to me. Especially if it's pumpkin spice.
That's what I'm talking about. So listen, everyone, we are big fans of Oats Overnight. We're all about healthy eating, but also at the same time, we're all about convenience.
Yeah.
So look, go ahead, go to oats.com. That's OATS.com. Go ahead and try their starter pack. Use the code DARKO10. That's DARKO10 and save yourself 10%. So our next two questions, Dr. Renee, something that I'm really excited about. You know, I've been trying to get people to leave messages on Speakpipe because I think it's really cool to get the context when someone leaves a message, you know, that is like a voice message
it's
on
more
the
personal.
website. I think so also. So we've actually got two messages on here that we need to answer. Okay. The first one is related to medical school, and this is from Chinyama. Okay. So she left a message some time ago. So let's go ahead and play that for the audience and we'll go ahead and answer it.
Hello, Dr. Lee Darko. I just wanted to ask how you managed to get through medical school and if you have any advice for medical students that are, you know, currently pursuing their degrees or pre-med or anything like that on how to deal with the stress, with the pressure, and how to keep the ball rolling and stay on top of things, and how you basically just manage to find a balance between life and school and that sort of thing. So any feedback from you would be greatly appreciated. Thank you.
Dr. Chinyama with the balance while in medical school question. That's a tough one.
Yeah, that's always a very tough question.
That's a really tough one. Speaking as someone who had no balance.
Do I have balance now?
In med school, but being able to look back with the retrospectoscope, right? As people say.
I mean, it's always a tough question, right? Because, you know, everybody kind of reacts to the amount of things that they have to do very differently. And so I guess the most general advice that I would give someone who's asking me about either, you know, work-life balance or school-life balance is to, one, figure out what your priorities are first, right? What are your priorities? And then go from there. And your priorities, when I say figure out your priorities, that might mean your overall priorities, or it may even mean your daily priorities, right? Because sometimes your overall priorities have to be kind of broken down into daily bites. So whereas today you may say, well, I need to get in, 3 hours of studying, tomorrow that might not necessarily be the case, but overall your priority is to do well in school and to complete your studies without becoming a maniac. So that would be the best.
I think that's a good answer. I oftentimes say, and I know it's easier said than done, is live in the moment, right? Realize that what you're doing is something that not many people get a chance to do. And that means literally being, depending on if you have to pay loans or not, but literally being paid to study and learning how to be an expert on the human body, right? And it's tough. There are going to be hard days, but you remember, this is an opportunity to really, spend time with people who are going through something all together with you. That's the other thing too, with your fellow classmates. That's one of the things that I think we still keep in contact with some of our classmates. Yeah. And it was something that I think, brought us closer together. So I think that it's important to spend as much time as you can studying and do as well as you can also. But I also think it's really important to remember who you are and to maintain you also. So if you like to work out, try to work out. That doesn't mean that you have to be like, this health freak, health guru, but I think you just have to remain yourself. Don't let medical school change you.
Right.
Right. That's the thing that I think a lot of people suffer through is they allow medical school to change them. Now, it's easier said than done, right? Because like you're literally just thrown into the ocean and you have to learn how to swim on your own. And you feel like everybody has it under control except you. So you feel like you may not want to reach out. But most medical schools have like the ability for you to get some counseling if you need to talk to someone. So I would recommend that too. If there is anybody out there who feels like they're overwhelmed or they just feel like they can't compete with everyone else, get some help. Usually medical schools have a way for you to get help anonymously.
Absolutely.
So get some help. And then also remember, like, this is just school. Like, you're a student. It's okay to ask for help. It's okay to make friends. It's okay to take a night off. It's okay to take a weekend off and to have fun and to just enjoy this process, because we oftentimes say, I actually enjoyed medical school way more than I did college.
Yeah. I always say that too. But that's because you knew me. So right. So you kind of left me speechless over there. Usually I'm not speechless. You're like, ooh, tenderoni.
Right. But we had a great time. Like, we studied hard. We went hard. Right. But at the same time, like, I remember, like, we would go out to the movies. We would watch bootleg movies all the time.
Oh, yeah,
right?
for sure.
We would hang out.
I do your hair when you had hair.
Yeah, I used to twist my hair. Okay. That's a little bit of a tidbit that people may not know. I used to have hair. I used to twist my hair. It was looking good, too.
But yeah, I mean...
Is that the reason why I'm bald? That's the key question.
Man, do not come to Dr. Renee, the hairdresser. But no, I mean, I think, everything that you said is so true. And that's kind of, you said it in a much better way than I said it. Your overall priority is one thing, but then you have to break that down almost daily into different priorities. So today your priority is, I got to get 3 hours studying in. Tomorrow your priority may be like, you know what? I haven't exercised in a couple of days. I need to exercise. Like, I need that, to keep that balance. And then the next day your priority might be, that whatever it is, but you need to basically stay balanced, and staying balanced doesn't happen when you have just this one thing, this one goal that you're looking at, and you never, ever factor in all of the other parts of yourself.
Right.
So you're right. You're absolutely right. You have to factor in those other parts of yourself, including family, including friends, including working out, including just sometimes you might need a mental health day. Sometimes you just need a day to veg out and watch garbage TV, and just veg out. So just understand that all of the parts that you are right now should not all of a sudden disappear because you go to medical school.
Yeah, don't let it fall by the wayside.
And I do want to add, this is one thing that I say to a lot of my pre-meds, this asking for help thing, right? Oftentimes, we have type A personalities and we're used to being the smartest kids, in our classes and things like that. And then we get either to college or to medical school. And guess what? You got to put in a little bit of effort, much more effort than you had to in the past. And that's okay. But sometimes you also have to ask for help. And what I say to my pre-meds a lot of times is, as a physician, I ask for help. If I'm in a difficult case, I ask for help. And so it is okay to ask for help. And actually, you're probably going to be a better physician for it. So you have to think about it like that. You have to think about the characteristics that will make you a great doctor. And asking for help is going to be one of them. So you might as well just get used to asking for help when you need it.
That's true. That's a good answer. The other thing I would say also too is, and I know sometimes, this can be information overload, but you asked for it.
Right.
You asked us, you came to us. But I'm going to say, take a chance to really go and look up, virtual mentors. All right. And what I mean by that is you not like specifically like speaking to people, but use YouTube. You're using this podcast there are plenty of examples nowadays of you being able to find your tribe, so to speak. People who think like you, people who can give you a really different way of looking at things. And although you may not be able to communicate with them, maybe on a regular, they put out videos or they put out podcast episodes or they put out blogs, which, or where they are living a life similar to what you're interested in living, and don't forget to surround yourself with that. That's what we did with personal finance, right? So that type of experience, I think you can definitely replicate with medical school. Now, I don't want you watching videos all day long, and not studying like, oh, this person gets me. Meanwhile, you're not studying. But you know what I'm talking about. Like
balance.
Just have some balance with it. There are plenty of people who feel just the same way as you. They're out there blogging, podcasting, vlogging, or whatever it may be. But I just want to thank you again for submitting this question.
This is a good question.
Yeah, this is a really, really good question. Thank you for using Speakpipe.
Yeah.
Mad props to you. So
you have a beautiful voice.
Hey, if med school doesn't work, you can be a voiceover artist.
There you go.
I shouldn't say that. That was bad. Now, last and definitely not least is our second question comment from Speakpipe. This one is from Kat. And let's go ahead and let this play.
Hello, Dr. Darko. My name is Kat, and I am an academic faculty at one of the few rural university centers in the United States. And I have been part of the DOTB Nation since July of this year. I just wanted to let you know how much I enjoy your enthusiasm, your outstanding communication skills and interview skills, as well as choice of speakers and interviewees on your show. I myself am in the midst of making a decision of transitioning from academic faculty to a locums position, as well as a globe-trotting physician with family in tow. I'm also in the midst of deciding that I want to have a podcast of my own with certain interests in line and certain specific topics that I wanted to discuss. And so I just wanted to get back to you and let you know and give you mad props for just being who you are and allowing us to listen to something different. Because when I was a resident or a fellow, this was not available. And boy, I would have really needed the lessons. I could have really used some help back then. So thank you to you and your wife, and congratulations on your second child. I hope you find wealth and blessings and happiness.
Well, Dr. Kat, thank you very much for the well wishes.
Thank you.
It's a really, really nice message. Definitely appreciate that. Thank you again for submitting your question comment through Speakpipe. Is definitely much appreciated. So, Dr. Kat is in academic medicine in a rural university in the United States and thinking about chucking the deuces and going locums and doing things across the world.
Yeah, and starting her own podcast.
Yeah.
Yeah.
Okay.
So, I mean, I think that, again, it's just very commendable, just like Dr. Saba, that Dr. Kat is starting to think about life outside the box, literally, and just thinking about more creative ways to, I guess, take her career and figure out what she really likes and what she really wants to do. Globetrotting is definitely something that a lot of people have been doing for years.
Dr. Carmen Brown did that. She was the first episode. Yeah. You have to go back all the way to episode 1.
Absolutely.
And she and her husband, kind of got sick and tired of practicing in the United States, but they didn't just jump and start practicing in a different country. They actually just started kind of globetrotting through the entire world, ended up in New Zealand. It was like, yo, this place is the bomb.com.
Yeah.
And then they decided to go back and just make a practice out of it. So.
Right. Absolutely. So I think that's like the first step, is just kind of recognizing that you want to do something and saying it out loud. I think a lot of us as physicians, we think it, but we never say it out loud. So I have to commend her for really putting that out there. Yeah.
That's great. Dr. Kat, I am really happy. There's actually one person right now who I think you guys should follow. Her name is, or she goes by IndieDocs. That's IndieDocs. she is a surgeon who recently graduated, but her and her husband, they actually travel, they do locums, and they just started a podcast.
Yeah. Dr. Joy.
Yeah, Dr. Joy. Make sure you check them out at Indie Docs. So, like I said in the previous question, it's all about finding your tribe, right? Finding your community of people. Maybe 10, 15 years ago, it would have been difficult and you would have felt like you were an island. You were alone. But nowadays, I mean, you can get that virtual mentorship. You can get that group of people who are really interested in doing what you want to do. Yeah. And I just want to say, hey, listen to the advice that we gave on the first question. I would definitely say for you, if you want to travel to different parts of the world and practice, there are companies that can help you do that. Right. I would also, at the same time, just make sure you have enough in savings so that you can go and travel and check out these places without having to make a rush job. Yeah. But I wholeheartedly congratulate you.
Yeah, that's awesome. One other person you might want to follow also is Nomad OBGYN.
Oh, yeah.
That's Dr. Mary.
Oh, yeah. Dr. Mary. Yes. Dr. Mary is literally a nomadic OBGYN.
She is, yeah. She's a glow.
She ain't got no home address. That's how much of a nomad she is. How do you not, I can understand in locums, but she ain't got a home. Where's she live at?
No home, right? The world
Dr.
is her
Mary,
home.
if you're listening, we're not making fun of you. It's actually kind of badass that you're doing this. So.
Yeah, Dr. Mary got it going on. So she may be someone else that you want to follow because she definitely globetrots. And when I say globetrots, I mean she has been all over the world.
I mean, she goes to Bucharest.
Oh, yeah.
How many people say I'm going to Bucharest? I'm jamming in Bucharest next week. How many people can say that?
And Dr. Mary, it's
Where's
funny.
Bucharest? Bucharest. I'm jamming in Bucharest.
She's jamming with Carmen Sandiego. But Dr. Mary started doing locums after I actually told her that I was doing locums. So, it took her about a year or so.
Career.
I ruined her career. I ruined her career and her life took off. So, but she started about a year after she asked me that question and she hasn't looked back since. So, and she does have a blog that she kind of chronicles her ventures, but I mean, it's definitely doable. And then as far as starting her own podcast, what advice do you have for Dr. Kat about starting her own podcast?
The quick thing to decide is what does she like talking about, right? It's very quick and easy to figure out what you like talking about. What are you passionate about? What do you want to talk about after episode 5, after episode 20, 100, and 1,000? Right. I think that's really important. And then I also think, don't get too caught up on the whole techie stuff. I think that's one of my biggest advice to you is just as long as you got your cell phone, I think you're good, particularly if you're going to be traveling. Right. But there's also a lot of equipment that you can get that you can travel with, like what I do. I've podcasts from airports and, right before I got on a plane or, different locums positions. So my advice to you is definitely whatever you feel passionate about, whatever you think you can definitely help the world with. I think I would definitely choose that as a topic. I would definitely be consistent and I would definitely reach out for help if you need it. You know how to reach me.
I would tell her she should take Dr. Nee's 10 days to podcasting course.
That's true.
You're very modest.
I know I'm very modest, but
you would never say that.
But if she's interested, that option is out there also. So
I'm your agent.
Yeah, you're my agent.
So go to
not only do you ruin people's careers, you're also my agent. Got you.
That's right. But I would go to www.10daystopodcasting.com. Look at you should see the look that he's giving me right now, guys. He's so modest. Oh my God. Have you ever seen a black man turn red?
So Dr. Kat, thank you again for submitting this question. I hope you're getting support at your job. If not, we support you. Yep. The rest of Docs Outside the Box Nation supports you in what you're doing. So if you're not getting support at your job, then you know what I say, F them.
We're here for you.
We're here for you. We got your back and definitely would love to hear, more about you, particularly when you start traveling.
Yeah, absolutely.
Well, that's it, Dr. Renee. I think that's all the questions that we have. So I want to tell everyone that we are coming out with merchandise really soon. I know I keep saying that, but T-shirts are coming. Merch is coming. So I want to, continue to encourage everyone to please continue to leave, reviews on Apple Podcasts. I'm telling you, yo, I read each and every one of them.
He really does.
It's really, really helpful. If out of anything that you can do, please just leave a 5-star review on Apple Podcasts. It really helps my show to grow, right? And it makes it easier for other people to kind of discover this show.
Yeah.
And then if you want to leave a question, we're definitely open to answering your question on a future Ask Dr. Nee segment. I say it and I like it better if you leave it on Instagram.
But that Speakpipe was...
But Speakpipe is excellent.
That was pretty good.
I didn't even leave Speakpipe as my order last time. So Instagram, Speakpipe, and then like email and then Facebook.
You do not like Facebook.
Facebook is just whatever. Anyway, so I'm not going to go on that rant again.
Yeah, don't speak against Facebook.
But I'll say Instagram,
they're watching.
Speakpipe, email, and then Facebook, guys. So listen, we're going to get going.
All right.
So Dr. Renee, thank you again for jumping on this Ask Dr. Nee segment. We had a great time.
Thank you for inviting me as usual.
So guys, I will check you later. But remember one thing, we only got one life. Let's make it count and live outside the box.
Peace.